There's nothing wrong with doing supine. This is the way we showed here. So you're going to apply pressure here. Sorry, I want you to bring your. That's basically it. Okay. So you can do it in supine, sure. But I just want us to do one. And also another one you can do in this position is knee extension. You can also do different positions. Same way. Can you push against my hand? That's basically it. Some of them you see once you become a therapist you'll do knee flexion this way too. It's okay. But I want you guys to start thinking why we are using that as we are kind of helping you guys to think about against gravity. So that we know 5, 4, 3, 2, 1. That's why we're kind of emphasizing you because of that. So you're going to apply pressure here and ask you to bring it up against your hand. That's it. And then I want you to
do internal external rotation.
Yeah, that is true. And okay, another thing is good point. So I'm jumping around. So internal external rotation means that your foot has to come outside. So I want you to bring this foot out like that. Yeah. Get outside. Yeah. Okay. So what I'm doing, the muscles acting are in here. So if the patient has only minimal, you want to be able to feel it. Okay. Kick it outside. Yeah. So that is by external rotation. I want you to bring it inside. Internal rotation. Make sense? Can you guys see it? Kind of. Yeah. So internal, external. And what else we need to do? Can you extension we showed you guys in this position. It's okay. You can do it. You can also do it in prone. Can you lie on your belly? So you can also do hip extension either with the knee flexed or extended. Can you bring it up? Yeah. That's fine too. We're just kind of showing you guys in one way. This is against gravity. That is also technically against gravity. If I'm doing like this, it's also technically against gravity. But I have to be in this position. Okay? So, abduction, adduction. Can you come on the side, please? Okay. If I'm doing adduction of this leg has to be up. Can you bring this leg up against my hand? That's what I do. That is for, I'm testing adduction of this hand, this leg. Okay. So for abduction, can you go up? This is good enough. So I'm going to give resistance. I want you guys to see because she's wearing jeans, I couldn't figure it out where her knee joint is. Okay. So I don't want to hurt her knee joint here. So please make sure that you apply resistance a little bit above the knee. Be careful with your patients because your patients are old patients coming with all these knee problems and all these things, and you want to be careful. And also, if you put a little bit behind, also you can hurt your knee. So technically, again, I'm not necessarily giving a support. It's pretty strong. Okay. So in this case, I'm just supporting here. I want you to bring this leg. You want to show your patient like this against my hand. You go. That's basically it. Do it. You see how strong you are. Come on. So you have abduction, adduction. When you have your person, I don't really get his left foot or right foot, but you kind of tell. I'm testing the adduction of this leg. So simple. Okay, just don't worry too much. If you just relax a little bit, and you should be good to go. Right? Gravity eliminated position. One more thing. Stephanie, is it 10 minutes yet? Okay, good. Gravity eliminated. Can you go on your back, please? Okay, if the patient has abduction, adduction, ideally this is the gravity eliminated position. Supported. Of course, there is friction there. Technically speaking, this is abduction for gravity eliminated, adduction for gravity eliminated. Make sense? So these are the ones they will ask you guys. So can you come on your side? For flexion and extension, this is the gravity eliminated position. flexion, I'm supporting her. See, I'm supporting her for flexion. Can you go back? Extension. So extension, you start measuring from here, not from here. So remember, those are simple things, but we can always get confused. So you're going to go from here 30 degrees or whatever it is, the range she's going to have. So I'm going to support her. No, the patient is GPS, patients, Guillain-Barré and all, you're going to have these kind of issues. So can you bring it up? Bring it up, please. So act like you're paralyzed. Okay. So you can do a little bit, tiny bit. Okay. So if you're a therapist, you want to feel her iliopsoas muscles here. If there is any flickering, feel it. You can feel it. You can actually. So that's why when you see your patients, if the patient is good, they don't. A lot of times you're working with them. Feel the muscles. Have that memory inside of you, the kinesthetic feeling, touching memory. You have to have it inside of you. It comes back when you need it. If you don't, you're going to have a problem later on. Okay. So that one, right? And what else? Internal rotation, external rotation, gravity eliminated. Do you have it there? This short. Technically, internal, external again is this one. Gravity eliminated. Okay. It's your leg is totally supported. Okay. Knee flexion extension. Can you come to the side? Again, knee flexion extension. Same thing. Can you bend it? Okay. This is flexion extension. Okay, that's it. When we do, technically speaking, even though, look at this, if you range of motion, we don't do extension, range of motion. But manual muscle testing, this is extension. Okay. So there are some things like that. Those are the little things you're going to have a problem. So if you think about knee flexion extension, gravity eliminated, you just go automatically to your Okay? Any questions?